This is Samantha Vervoort, and I'm going to be discussing our chapter on neuropsychological testing from neurological surgery. The goal of our chapter is to review the rationale for and methods used in neuropsychological assessment, specifically in the context of neurosurgery. Neuropsychological evaluation is a type of psychological assessment that examines the brain through observable behavioral products. This brain-behavior relationship is studied via paper and pencil or computer tests that can assess cognitive functioning across different domains, such as working memory, visuospatial skills, and motor function. Neuropsychological assessment can serve a number of purposes in both research and clinical settings. In a neurosurgical context, these functions can include assessment of cognitive, social, emotional, and sensory abilities, quantification of recovery of function after injury, prediction of performance in real-life circumstances, determination of cognitive and/or social processes performed by a brain region that is a candidate for surgical excision or modulation, and prediction of quality of life. Neuropsychological assessment serves an important function in clinical and interventional settings. Clinical neuropsychologists can help identify individuals at risk for disease, recognize pre- and post-intervention changes in performance, such as quantifying recovery of function after brain injury or neurosurgery, and help the patient and their family achieve maximal levels of functional outcome. This table demonstrates some potential uses for neuropsychological assessment and illustrates the variety of roles a clinical neuropsychologist may take in a neurosurgical setting throughout the care process. The tests that neuropsychologists administer have undergone varying degrees of standardization. This allows for comparisons across both time and individuals. These evaluations generally involve direct assessment of the patient, but may also include reports from caregivers or other informants. Direct observation of the patient by the clinical neuropsychologist also plays a key role in assessment. The assessment batteries utilized by the clinical neuropsychologist may be standardized, tailored, or some combination of the two. Standardized batteries, such as the Halstead-Rayton Neuropsychological Test Battery, are an exhaustive, comprehensive series of tests that are administered to each patient, regardless of the specific referral question. A process-based or tailored approach is largely driven by the specific referral question. In this approach, tests are not administered in the same standardized way, and conclusions are made based on clinical experience. There are advantages and disadvantages to both approaches, and a clinical neuropsychologist must generally construct a battery based on context and practicality, especially given potential time and financial constraints, or constraints introduced by other means, such as the patient's status. To this end, abbreviated test batteries that take an average of 30 minutes to administer to completion have been standardized and made available for use. This table from our chapter, shown on this slide and the next, outlines some of the neuropsychological constructs that a clinical neuropsychologist can examine, along with some tasks that are used to measure those constructs. Executive function, memory, working memory, visuospatial skills, attention, processing speed, verbal fluency, motor function, sensation and perception, and emotional and psychological distress are some constructs that can be quantified by clinical assessment. In the case of brain cancer, a number of factors impact brain function, including the cancer itself, surgical treatments, and post-surgical treatments, such as radiation and pharmacological agents. Clinical neuropsychologists are particularly suited to quantify these cognitive and behavioral outcomes post-surgery. Assessment can also monitor affective responses to treatment and determine the need for psychological interventions. Additionally, the clinical neuropsychologist can help guide rehabilitation efforts based on these cognitive, behavioral, and affective outcomes to achieve maximal long-term outcomes after the cancer has been successfully treated. Clinical neuropsychology provides an essential complement to neurosurgical patient care by determining pre- and post-surgical neurobehavioral status, distinguishing between cognitive and affective contributors to behavioral disruption, helping predict success in return to work and daily functioning, measuring recovery of function, and helping guide rehabilitation programs to promote successful outcomes.